So this video is going to look at some foundational issues of just some of the things we're going to look at this semester. Kind of gives just a very good overview of just some general things as it relates to any healthcare profession, different ways to communicate, and some other important aspects about managing healthcare information. So when you look at communicating with other healthcare professionals, so obviously as an athletic trainer, you're going to be communicating with other healthcare professionals, be it physicians or other allied health professionals. So it's important that you kind of really know how to communicate well, understand medical terminology. So some of the important things we're going to look at is understanding medical terminology and abbreviations. In your textbook on page 5, there is a list of some common medical terminology. I'd like you to take a look at that. So there's some terms that you need to be aware of, and over the course of the semester, we'll kind of highlight some other terminology as we go and kind of look at some of the other individual systems. Understand the difference between a sign and a symptom. So when we look at signs versus symptoms, so a sign is something that can be objectively measured when you're doing an assessment. So it's something that, you as an athletic trainer would be able to see, feel. For instance, you could measure someone's heart rate. You could measure someone's blood pressure. Those would be things that are considered signs, whereas symptoms are something that the patient would feel or tell you about. So a patient may tell you that they have a headache. Okay, so that would be a symptom. Or they may say that they have pain or something hurts. That would be a symptom for them. So a sign, something that you could see, feel, you could objectively either measure or record. A symptom is something that the patient will report to you and is a little more subjective. Understanding different physical specialties. So as a healthcare provider, it's going to be important that you kind of know and understand what the background of other healthcare providers are. Table 1.1 on page 6 in your textbook goes over a list of healthcare providers, their education, their degree. So take a look at that table. You'll be responsible for kind of knowing, the different education levels and what the different individuals do. So be aware of what they, when you look at that table, keep in mind what their education is, what they're allowed to do, in particular when you look at, say, for instance, prescribing authority, what allied health or what healthcare professionals are able to prescribe medications. So looking at health information and how it gets shared and communicated among medical professionals, there are regulations in place that dictate how this information can be shared. So in other words, when an individual goes to a healthcare facility, their information's private. They need to have, they get control over how that information gets shared. So the two laws that we have to consider, HIPAA and FERPA. So HIPAA, which was implemented in 2003. This is a federal mandate that protects patient privacy and kind of oversees medical records coming from healthcare agencies. So basically what this does is it helps to kind of protect patient privacy and gives them kind of control over how their healthcare information gets shared. So many physicians' offices, when you go there, they give you paperwork up front saying, okay, here's the HIPAA law. If we need to share this information with another physician, you have to give us permission in order to do this. So that's if you're working at an actual healthcare, within a healthcare facility like a physician's office. A lot of times just by the nature of the setting, for instance, if you're an athletic trainer working at a high school or a college, that information would fall under FERPA. Okay, so FERPA applies to schools, and in particular schools receiving funds from the United States Department of Education. So it functions very similar to HIPAA in that it gives people access to and limits the disclosure of their records, in particular when you're looking at students. So now in regards to FERPA, parents have a right to look at a child's record up until they're 18 years old. Once they become a legal adult or attend a school beyond high school, those rights transfer. Okay, so then that becomes the student's record. After that, the child would have to sign a waiver in order for the parent to be able to view their record. So both of these again are intended to help from a privacy perspective kind of oversee the different medical records. So again, HIPAA is more pertinent when you're talking about a specific type of healthcare facility, doctor's office, hospital, what have you. FERPA is in regards to education, so high schools and colleges. Okay, so looking at medical records, really important that you, in whatever setting you're in, if you're doing patient care, you have to have adequate medical records. Okay, this is for good continuity of care of your patients. It's for legal protection for yourself. All very important, and it's obviously not only important that you keep them, but you also maintain them and keep them in an appropriate manner. And we're going to talk a little bit about this because medical records are basically legal documents, and they need to be kept accordingly. So they should be stored in areas with limited access and in accordance with institutional and state regulatory acts. So really important. So in other words, you can't just have just an open cabinet that everybody could access medical records in. Okay, so they need to be stored in a particular area. They should be, for instance, in maybe a lock filing cabinet with, where individuals or there's limited access to. They should not be in areas where just anybody can go and access them at any time. So these are just some examples. So unsecured files, open storage areas, unprotected computers without a password, encryption. So those are all examples of inappropriate medical storage, okay? So if you're going to do, for instance, computerized documentation, the documentation should be password protected, okay? And there should be encryptions that kind of protect that information. So again, basically, to kind of sum that all up, it should be kept somewhere that not everyone has access to. The only people that should have access to medical records are people in the department that need to be able to access them. So for instance, the athletic training staff, whoever else would be involved within that group. Okay, it should not be in a common area or somewhere where just anyone can gain access to. Okay, prevention of disease transmission, and some of this information you may have even had in your emergency response class. We're going to talk a little bit about some of the different things that we look at in regards to prevention of disease transmission. Obviously, as a healthcare professional, you're going to be dealing with blood, bodily fluids, and good practices can just help prevent disease transmission between individuals. So we're looking at protection from infection, maintaining a sanitary environment. We'll talk a little bit about cleaning and sanitizing surfaces within a facility, very important. Immunization is also very important with vaccines. Okay, so for instance, obviously we talk a lot about hepatitis B vaccination. So, very common things for all allied health professionals is to get hepatitis B vaccinations to help prevent against that transmission. And as we all know, OSHA, or the Occupational Safety and Health Administration, they kind of set certain standards, and we're going to talk about some of those standards as it relates to protect both workers and patients. Okay, so a lot of times we think that this is just to protect us. It's also to protect patients. Okay, so it's important to look at that kind of from both sides. So they kind of set these standards, and we'll talk specifically about what are some of the standards, particularly as it relates to bloodborne pathogens, to help limit disease transmission. All right, the Occupational Safety and Health Administration bloodborne pathogen standards. So there should be a written document in place at your facility that goes through the steps to take in the event that someone is exposed to infectious waste. So this is intended, and the reason why OSHA puts this in place is because it's intended to protect healthcare workers from having an exposure incident, and it should cover anyone who could reasonably anticipate having an occupational exposure to infectious waste. Okay, for example, blood. Obviously, we deal with a lot of wound care. Very important in order to make sure that, one, to prevent an exposure, and number two, if someone does get exposed, how to kind of handle that situation. And that's one of the things that the exposure plan would outline, is what to do in the case, because again, sometimes no matter what you do, you can take all the appropriate steps, something could still happen. So it's important to make sure that there's something in place, and it should be, and again, you could tailor this to your work setting, so it should be individualized. You could look at it being setting based, depending upon if you're an athletic trainer working at a facility, if there's multiple venues to kind of tailor it based upon that. One of the important aspects of this is to make sure that all healthcare workers have access to personal protective equipment. So OSHA wants to make sure that everybody who could be exposed has this personal protective equipment. And we commonly, probably the most common thing to get utilized are gloves. At the very least, you should have that, but this also covers other types of personal protective equipment, eye protection, gloves, gowns, anything also to make sure that appropriate hand cleaning supplies are available. Again, obviously soap and water for washing your hands. In the case that you don't have immediate access to soap and water, there should be other types of hand sanitizing, gels, antibacterial cleaner available in that case that it's not available. One of the things that OSHA discusses is the use of universal precautions, which is to emphasize that all human waste should be treated as if it were infectious. So no matter what, you have a wound care situation, you're treating that bodily fluid, blood, as if it were infected. And this way here, that could help to prevent any type of exposure incident. So they outline specific components of this bloodborne pathogen standard, and some of the things we already discussed, but I'm going to go through some of the important components now. One of them is appropriate glove use application and removal. If you look at page 9 in the textbook, in the clinical tips, it goes through correct glove use, so make sure that you review that. Not only just the using gloves, but what you should do before you use gloves, how you should remove the gloves, because again, appropriate glove removal is important. Obviously, the biggest key with glove removal is not touching any part of a glove that has been, with your bare hand, that has been exposed to the bodily fluid. Other personal protective equipment falls underneath the components of the standard as well. It's what we've kind of discussed earlier. So, any type of face and eye protection, okay? And here's actually a clinical example. I always used to wear eye protection anytime I would open up a blister, because sometimes the pressure, the fluid could sometimes kind of squirt out a little bit. So it's important that you kind of protect yourself from that beyond just, possibly just applying gloves. Sharps containers are another important component. So if you do use any type of sharps instruments, syringes, scalpels, that the sharps containers have what they are is they're self-contained units that have one-way valves. If you've never seen a sharps container, page 9 shows a picture of a sharps container. So they should be made out of a hard plastic. So, and there should be a service that helps to maintain them as well. So that includes regular emptying and inspection for safety. So it's very important that sharps containers be made available. Any type of disposing agent, okay, a sharps container, or even just bags for non-sharp items that have been exposed to bodily fluids, they should all be clearly marked, okay? the bags used to handle infectious waste, they should be red, they should be clearly marked as biohazard. So whether it's the sharps container or for disposing, bags that are used to dispose of infectious waste, that should all be clearly marked. Disinfectants are another component of the standard. So now it's important to denote the difference between a disinfectant versus a disinfectant cleaner. So a disinfectant just helps to kill any type of infectious pathogen in the bodily fluid. A cleaner helps to remove the soil. Okay? So for instance, bleach is a disinfectant, but it's not a cleaner. Okay? So it's very important to differentiate between the two. In order for something to be considered hospital strength, it must eliminate 100% of all the organisms listed on the label. So if you do get a disinfectant, it will tell you what organisms can be basically eliminated by using the disinfectant. So you must utilize, obviously, an effective disinfectant. Use it regularly. It's very important that you also use it appropriately. So for instance, if you are going to use a disinfectant, so all contaminated surfaces must be sprayed. HIV disinfection, for instance, requires 30 seconds of saturation. Hepatitis B, it is a much stronger pathogen, requires about 10 minutes of saturation. So you can't necessarily just spray and wipe off right away. Particularly when you have a heavy soil of a bodily fluid, you must make sure that it remains saturated for an appropriate amount of time to make sure that all of the pathogen is destroyed. If you're going to make your own out of bleach, it's recommended to use a 1:100 ratio of freshly prepared bleach to water. And that could be used for disinfecting. So you don't necessarily have to go out and buy a specific disinfectant. That's recognized, a solution of bleach to water in that ratio that is recognized as something that can be utilized in order to disinfect a surface. Now, that's a little weird to hear 1:100. You think, well, how do you determine that? An example could be using a quarter cup of bleach to 1 gallon of water. So if that kind of makes sense a little bit more, that's a measurement that you can utilize in making your own disinfectant, and that would be just as effective as any type of pre-mixed solution that you would buy. And the one thing to note is if you do buy a solution, so say you go and you order like a pre-mixed disinfectant, if you buy, like, for instance, the big jugs of it and you go to put it in another bottle, that second bottle has to contain all the information about the disinfectant, or else you're not following OSHA standards. So if you buy, again, a refill bottle, make sure the other bottles that you pour them into, the individual spray bottles, have all the appropriate information necessary for that disinfectant. Okay, so moving on from OSHA and the bloodborne pathogen standard, we're going to look at some legal considerations. So there are legal ramifications that you have to consider when caring for athletes. So as an athletic trainer, you're an allied healthcare professional, you're held to a high standard of care when dealing for your athletes. And in looking at this, there's two things that in particular we need to point out and discuss: the concept of duty and negligence. So duty is a kind of a moral obligation to act, and here we're looking at it as a legal term. So as an athletic trainer, you have a duty to act in regards to your patients to provide them a certain standard of care. If for some reason you do not provide that standard of care and then cause harm, you could be considered negligent. Okay, so that's where negligence comes in, and that would be a situation where you would be under liability and possibly get taken to court and found negligent in a duty if therefore you cause harm to the patient by not keeping up to a certain standard of practice. And the way that basically gets looked at in a court of law, if there would ever be a situation where an individual would be brought to court over a lawsuit, for instance, something happened to a patient and they decided to take the athletic trainer to court, what the courts would do is look at it, did they act as a reasonable and prudent person would underneath that same circumstance? So in other words, did they maintain a basic standard of care? If an athletic trainer did that, he or she would not be deemed negligent. If they didn't, then they would be held responsible. So, maintaining your skills and knowledge, providing a reasonable standard of care, appropriate referral when necessary, these are all things that need to be in place. Upholding patients' right to privacy, these are all examples of things that kind of all fall under a certain standard of care. So in looking at the BOC standards of professional practice, so this would be something that would serve as a resource, because in these situations where there would be a dispute over something having had happened and it be brought to court, because this is our standard of care. So the BOC standards of practice, you'll be considered negligent if you fall below a level of standard of care. And it's important, obviously, all the time as an athletic trainer, maintain your knowledge, make sure that you're following best practices in your work setting. And another thing legally, because this is a lot of the legal things that do come up typically come in regards to emergency situations. So your EAP, or your emergency action plan, very important to make sure that for your facility you have an emergency action in place, you practice it, you review it at least once a year to make sure that everything is in place. Basic things that need to be part of the emergency action plan: early cardiac defibrillation, presence and access to a physician, communication between on-site personnel in a medical facility, transportation to a facility. Those are all things that need to be a part of your EAP. Okay, and again, there's all sorts of examples you can look at of this, but those are the basic components that need to be included. And again, that needs to be reviewed yearly to make sure, if you do have, say you have a construction at your facility, and now maybe the facility has changed a little bit, you need to make sure that your emergency action plan reflects that within the document. Patient-reported outcomes, this is something that is becoming more and more commonplace, and what it does is it just kind of helps with quality of care to the patient. You do typically see this used in the clinical setting, so a lot of clinics use this, and it kind of helps particularly with third-party billing. And what a patient-reported outcome essentially is it's data collected from the patients. Okay, so it's some type of, typically in many cases, a form that a patient will fill out, and it will give you insight into their symptoms, any disability related to their condition that they may have, their current health status, their quality of life. These are all things that then you can then get to see, is your treatment working? Okay, so a lot of times you'll kind of start out with a baseline report and then maybe do one, sometime down the road, depending upon what that patient-reported outcome calls for. And usually it's some type of like Likert scale type thing where, it's either a numerical order that just kind of correlates with how the patient's feeling. So again, this just kind of gives you something to work off of to see, is your treatment working? Is it truly making them better? The one thing this does is it does help to engage the patients. It helps to make them active partners in their progress, and then they could kind of see that the treatment is working. And again, as I had said earlier, these are often presented as scales that kind of correlate with different aspects of the patient's life, so that you could kind of get some sort of measurement of how it is that the patient is doing with their reported problems. So for instance, if a patient comes to you and they have back pain or they have a back injury, you would use a patient-reported outcome on back pain and kind of see how that would kind of see how they would progress over the course of their treatment. And it kind of guides in addition to bringing the patient in, it also gives the clinician, some sort of, realization as to whether or not their treatment is actually working. Evidence-based medicine is another important aspect in a lot of this foundational information that we're talking about. And over the years, there's been a big push to move towards evidence-based medicine. And essentially what evidence-based medicine is, it's the blending of best research evidence and clinical expertise. And that's important. It's not only just the research. The research is important, but the clinician, we also have to look at clinical experience and expertise in making healthcare decisions. So it's kind of a combination of the two. So it's really important to not only look at research, but also then kind of see, based on experience and expertise, does a certain treatment work? Does a certain evaluation tool work appropriately? It also involves the patient's values, okay? So, again, we always have to consider the patient as well. So we have to look at everything as a kind of a patient-centered problem. Again, that's what we're here for. We're here to do the best thing for our patient. So we have to keep in mind that the patient's experience of this is included within evidence-based medicine as well. So essentially what you're looking to do is you're looking to seek kind of validated research. So you're always wanting to look to do, treatments. You're always wanting to do assessment practices that are going to be basically validated and use good evidence. And there's all different types of levels of evidence. It's kind of beyond the scope of this talk. You'll certainly get more on evidence-based medicine throughout your education, but to be able to know how to seek research, and it's probably as easy now as it ever has been in order to do that. So it kind of completes that circle and then gives the best available care to your patients. Okay, so this kind of takes us back now a little bit, going back to our documentation, and there are some things we're going to look at here for particular work settings. So hospitals and clinics and medical offices are where a lot of times this information will get used. We're going to talk about the ICD, or the International Classification of Diseases, and also the CPT, or Current Procedural Terminology. So these are important things that are both medical classification systems and ways to categorize diseases and conditions. So, as I said, if you're going to work in a medical office, a hospital, or clinic, these are really important as it relates to insurance billing, or anywhere where you would do third-party billing. Obviously, some colleges actually do third-party billing in some situations, but this is the ICD in particular. Is, again, as I say, the International Classification of Diseases. So what it does is it looks at the diagnosis, and there's a classification manual linked to this. What it means is that it's used to diagnose and track conditions in providers seeking reimbursement. So if you're a healthcare provider seeking reimbursement, you're required to submit diagnosis codes when you're billing or you're requesting authorization of services or procedures. So you have to make sure, if you're doing your third-party billing, that you code everything correctly. And what the ICD-10, and you can see examples of this in your textbook, table 1-2 on page 12. And you don't have to memorize all the numbers and the descriptions for the purposes of class, but at least kind of gives you an idea as to what they look like. So there's letter and number codes basically denoting a condition. So when you're treating somebody for a condition, you have to have documented the ICD-10 code when you're submitting that for billing purposes. And then as I had also stated, we're also going to be talking about what are called CPT codes, or Current Procedural Terminology codes. They're published annually in January by the American Medical Association, and what they do is they contain 5-digit codes that identify a procedure or service rendered. So the ICD-10 more or less looks at a description of the actual condition that you're billing for. The CPT codes are a set of codes that are associated with procedures and services that you do. And these are 5-digit codes that identify a service rendered. So the CPT codes, and there's examples within the reading. So for instance, if you do an athletic training evaluation, you do ionophoresis, and you do manual therapy techniques, there's 5-digit numbered codes that would go with each one of those when you go to submit your codes for billing purposes. Again, it's not something that in a lot of, I guess, what you would call traditional settings, high schools and colleges, that get used a lot. But if you're working in a setting where you have to third party bill, you have to at least be aware of this and kind of be able to utilize the coding system. Okay, the last thing we're going to look at in the foundational part here is the pre-participation exam, and we'll discuss this actually a little bit more in detail as it relates to information in the second chapter on just the medical assessment. But essentially what the pre-participation exam does, it helps to determine an individual athlete's ready for a specific sport, and even more so important, it helps to identify anything that could potentially become an issue for the patient, whether that's something that could just impair their performance or possibly cause more harm to them. So in other words, if they played the sport, would the condition, possibly cause them a great deal of harm? And it allows people to kind of recognize those. As far as the pre-participation examination goes, American Academy of Family Physicians recommends that all athletes have a pre-participation exam. More particular, student athletes are required to have a comprehensive pre-participation exam when they enter middle school or high school, or if they transfer to a new school. Okay, and then what is then recommended is that comprehensive evaluations at 2 to 3 year intervals occur for older students, and that includes annual updates on their health history, problem areas, and vital signs. So these are certainly things that can help in determining any possible issues for young student athletes. Also, once a student enters college, if they're going to participate in intercollegiate athletics, the NCAA requires a pre-participation exam upon entrance into intercollegiate athletics, and then after that, they're just required to have an annual health history update beyond that. So, for instance, college athletes coming into their freshman year need to have another physical done. Then after that, it's typically just an annual health history. And again, all of this should include not only any orthopedic issues, but should also, again, involve non-orthopedic information as well. So if you look at some of the examples, and I'm going to refer you to the textbook, pages 14, 15, 16, and 17 include forms that kind of give you an idea as to what gets looked for. In other words, what the line of questioning with most of these physicals tend to look for. So please review that. And again, some updates have occurred just due to recent, findings that your textbook talks about the issue with sickle cell trait, and how if individuals have not been deemed to not have sickle cell trait, that they need to have that status updated. So, and again, it's just to provide for safer participation for the athlete. One thing, there's two kind of thought questions I'm going to have you kind of look at. Are one, when should the pre-participation exam be conducted? So there's an optimal time frame, and you can see that within the readings of your textbook. And two, there's two basic types. There's the station-based physical exam, and there's the office visit. What are the advantages and disadvantages of each one of those? So kind of take a look at that when you're going through your textbook. And then determining sport qualification. So obviously the reason why we're doing this is the individual, physically capable of playing the sport without having any increased risk or danger to them. So there are certain medical conditions that may disqualify an athlete from certain sports, or just from competitive activity altogether. And as we kind of go through some of the things in the medical assessment chapter, and then once we get into the individual body systems, we'll discuss certain conditions that will place limits on these individual athletes. The last question I'm going to kind of look at here is who has the primary responsibility in determining risk. So if you haven't yet read the chapter and you go through it, keep an eye out for that as well to kind of answer that. So again, make sure that kind of concludes this. Make sure that you go back and you look at those figures and tables that I had referred to, just to kind of help you gain a greater understanding of some of the things that we discussed here.